Okay.
All right. I think Stan is going to be putting this on. The membership summit is on October 15th. And in the tax world, October 15th is a big day. So there will be no boring tax accountants at this meeting. So it should be very exciting, very good time. I'm sorry I can't make it because I really want to go.
Okay.
Thank you for that.
So somebody go in my place.
Does anybody have an update on Dick?
No, I don't.
See if I can get one and shoot y'all an email. Annalisa's mother just passed away, so if you see her or want to send her a card, please do so. And I think now we can do our speaker.
I think that's a good idea.
I think so too. And Stan's going to introduce our speaker.
Excuse me, I have to connect with the electronic.
Have to connect.
Yeah. This is Erin, everybody. She is a Rotarian from the Kitty Hawk Rotary Club. She's been a Rotarian for 6-8 months.
Yeah,
Not like
sounds
that.
about right. Yeah.
I ran into her by visiting that club. And I was forced to sit beside her, and she was very interesting. So I said, you need to be a speaker at our club. What's that?
It goes the other way around.
Oh. Who are you? Why do you keep showing up randomly at meetings? But Erin Briggs is a doctor of pharmacy, PharmD, in the business, I guess it's called. She is with today's program's Global Health Organization and the role of a pharmacist. We did some great research on her. No, John did. If you read your email, you can see the great bio that he found online about well, probably not everything she does. But I found her very interesting in the fact that this is kind of a semi-vocational presentation because she lives in here, but her work is worldwide. So I think it's kind of, you see a lot more of that now, and this is just another example. So it's all yours.
Thank you.
Erin.
Thank you for the introduction, Stan. Appreciate it.
Yeah.
I'm Erin Briggs. I moved to Kill Devil Hills 2 years ago with my partner. I was working prior to that in an office with my, I work for 2 nonprofit organizations. I was working in the Connecticut area. We came from Brooklyn, New York. I was commuting up to Connecticut. The organization I was working for was AmeriCares. I still do work with them. However, I'm going to focus today on the work that I do for an organization in Haiti. So I'm still working remotely, and my partner Patrick was working remotely, and now he's a full-time professor at the COA. So he is going in to teach. He's an art professor there.
How cool.
So he's now going to Elizabeth City, and still works a couple days a week at home. So Friends of the Children of Haiti, which we refer to as FFRC, so I'm going to use that acronym from now on, is the organization that I'm going to talk to you about today. I actually started volunteering with them in 2011. I was working at Kroger Pharmacy in Richmond, Virginia at the time. I was on a very short break for lunch, as usual, and it happened to be able to, I picked up a magazine called Drug Topics that was in the back of the pharmacy. There's a tiny little article in the magazine about FFRC, and it was interviewing the pharmacy director at the time. And I've been really interested in doing more humanitarian type work in pharmacy. I've been out of pharmacy school for just a couple of years, but I hadn't really found an organization that really spoke to me and kind of had what I was looking for in the type of work I wanted to do. But FFRC was exactly what I wanted. Yeah, they provided short-term medical mission trips. They needed volunteer pharmacists. So I emailed the pharmacy director, and I think I was at Haiti 2 months later. So I was traveling to Haiti twice a year as a volunteer, working in the pharmacy for 2 weeks at a time. And then in 2014, the pharmacy director wanted to resign, and I was nominated by the board to become the new pharmacy director, which I've been doing since 2014. So that means that now I oversee the entire pharmacy operations as well as order all the medications for the pharmacy. Now the history of FFRC is really interesting. This is a picture of the two founders, Dick and Barb Hammond. They're standing between our in-country physician, his name is Dr. Franzo Nelson on the left, and then our clinic director, Andre Boyer on the right. And this is during one of the golf outing fundraisers they do. So Dick and Barb were traveling to Haiti. They first went to Haiti on a cruise where they were dropped off at the Port-au-Prince port. And that was their very first experience of seeing how poor and in need patient people were. So they went home to Illinois and immediately started to plan to go back to Haiti to start doing medical mission trips. So that was in the 1970s. They originally were doing this through a local parish in Illinois, and they got connected with a parish in Haiti. So they were bringing volunteers down and doing medical clinics in a church. And then let's talk about the operations first. So and then we'll talk about the building. So in the last 30 years, FFRC, the organization, has operated a healthcare clinic in rural Haiti. So they chose this area of Haiti, which is the town of Sabatier, and you can see it's about 3.5 hours over a mountain range from Port-au-Prince. So all the volunteers would typically fly into Port-au-Prince, and then when I first started with FFRC, they had enough money for us to get a little jumper plane over the mountain, and it took about 20 minutes, and then they started to have to put us in a bus, and that was about 3.5 hours or 4 hours driving over the mountain range on a bus. So the clinic's been able to provide not only chronic condition treatments, but also acute conditions, as well as counseling and education over the last 30 years. This community was chosen where FFRC has been located because these patients have no access to other healthcare. It's very rural, it's kind of mountainous. FFRC clinic is actually on the water, on the ocean, but the mountain range right behind the clinic is where most of the patients walk from to get to the clinic for their free healthcare services. So the region, the department that, like I said, FFRC is in the Sud-East. The town is called Sabatier. So the facility, the actual building, was built in 2000. And I have a picture of that coming next. FFRC's headquarters in the United States is still located in Peoria, Illinois, which is where the founders are originally from. And we actually have a really close relationship with OFS healthcare system there, which is really helpful because that's how we get a lot of our volunteer pediatricians, medical students, EMTs. They can get recruit volunteers to come in and work. So here's what the facility looks like. It's a 3-story building on the water. The water's actually on the other side of the building. It's a 6,000 square foot clinic. In-country builders and contractors, so Haitian staff, built the clinic. Took them a couple years. And you can see on the right-hand side here, the bottom part is where the clinic is. So that's actually where the pharmacy is, exam rooms, lab, restrooms, and laundry room. The second story, when the volunteers would come, is where we would sleep. So those were the men's and women's quarters, and then the kitchen area. And the top floor is kind of like a living room area and a place for us to spend time in the evenings looking out at the ocean. This is a picture. We actually see patients outside underneath the carport. So patients wait outside underneath the canopy on benches. They see the physicians outside, and then their last stop, which is where I always was they come by the pharmacy to pick up their prescriptions before we leave. And the last couple of years, we were able to build latrines for our patients. So before, there was a bathroom, but it wasn't really that accessible. So now they have full service bathrooms available while they wait, because some of our patients are waiting all day to see the doctor. And some of them are actually sleeping at the clinic on the benches overnight, waiting for the next clinic day start. So this is the pharmacy. It's on the first floor, like I mentioned. This is where I would spend most of my time. This is actually Roger. He's our head pharmacy technician, and Nadine is also another pharmacy technician. They were both trained as pharmacy technicians in Haiti. They're our in-country staff, and I'll talk a little bit more about them because as COVID has kind of had made us adapt to how FFRC operates now, they have taken on a leadership role within the pharmacy since we no longer have volunteers. But you can see I probably took this picture standing in the corner of the pharmacy, so that's about the size of it. But all things considered, we have a pretty robust pharmacy. We have about 90 prescriptions. So we have a full range of medications to treat most conditions that we see at the clinic. Okay, so a little bit more about clinic operations. Like I said, historically up until the pandemic, and a lot of the political unrest and security issues that have been going on in Haiti pretty much since 2019, 2020. Volunteer teams of about 20 Americans, so physicians, nurses, EMTs, pharmacists, and we'd also have non-medical, would travel to Haiti 4 times a year to work for 2 weeks at a time. So they would work alongside the 40 in-country staff that we hire that are employed by FFRC, who get paid a living wage to work for the organization. So those are doctors, nurses, translators. We have people doing crowd control. We have drivers as well, among other things. So actually before the pandemic, Haiti started to get the security risks involved started to become more than it was worth trying to get US teams down here. Fortunately, the organization had already planned, or always wanted to aspire to, having a fully functioning clinic that can be run with in-country staff without the need of American volunteers. That was the end goal. We thought maybe that was going to be 10 years from now, but we got pushed right into it with the pandemic. So our 40 staff have been operating the clinic without ever missing a single clinic day since we stopped having volunteers travel. So we've been really fortunate that the healthcare of the population has not been interrupted. So in terms of clinical services and what FFRC actually offers to its patients, we're in a unique situation too, because you can clump us into like medical mission trip organizations because we take American volunteers and they go on a short-term trip to go to provide healthcare services in a country outside of the United States. But the way that FFRC is unique is we actually provide continuity of care. And we do this with what we call our vital health clinics. So those are the clinics that we have 4 times a year. Currently, we're hosting them in January, April, July, and October. And these are the 2-week clinics. So the FFRC facility opens, all the staff come in, and they treat patients throughout those 2 weeks, these 4 times a year. We provide prescriptions for 3 months at a time. So the patients get through each clinic and then they also get what we call a return to clinic card. So they receive a card to come back to see the doctor again at the next clinic and also get a refill of their prescriptions. So we treat conditions like diabetes and hypertension and asthma and seizure disorders and other chronic conditions because we can give them enough medication to get them through so that they can use us as their primary source for healthcare. We also treat acute conditions. So we see a lot of infections. We do a lot of wound care. The primary wound care services that we provide, because we see our burns primarily from cooking over an open fire, machete accidents. There's lots of motorcycles, so like road rash from motorcycle accidents. We can, and unfortunately, sometimes patients don't realize the urgency of needing to come in, and whether that's, get their wound debrided or get on an antibiotic. And typically, sometimes we're seeing these when they've kind of gotten into the later stages of being in really bad shape or infected. We used to, until probably around 2020, probably around the pandemic, we'd only have the clinics every 3 months. However, we realized that if somebody has an infection, they're going to have to live with something even as common as a urinary tract infection. Somebody might have to suffer through that for multiple months before they can get treatment. So what we started to do was we opened the clinic for every Saturday, once a week. So we only see acute care patients. So our diabetes and our hypertension patients don't come back once weekly, but we see about 50 patients every Saturday who can get treated for those acute conditions. So that's something we started over the last couple of years. Like I mentioned, our pharmacy has life-saving essential medications. We also provide dental services. That's a new program that we're doing. We've always provided surgeries. The surgeries actually happen in a larger town over. The town is called Juckmel. There's a hospital there. So we've had a surgeon traveling with us for many, many years. He has trained Dr. Nelson to perform surgeries without him. So we have highly trained in-country staff to do surgeries. They're usually minor surgeries like hernias and things like that. So other programs we have is my sister Shelly actually started our water sanitation and hygiene, our WASH program, where we provide water filtration buckets to remote areas. So that's one of the programs where we actually travel out to the remote areas and provide service. And our patients will get a water filtration bucket so that they can have access to clean water. We also have a malnutrition program for children, which is called the Mtg Mamba program. I don't know if you're familiar, the more common term is clumpy nut, but it's a high protein and fat bar that is approved by the WHO and UNICEF to be used to help children with malnourishment, get them up to their proper weight. And then we have a maternal, neonatal, and child health program where we provide prenatal vitamins, infant vitamins, children vitamins, and we also do breastfeeding counseling and training. All right, so you might be wondering why Haiti, or maybe you're not, because I feel like a lot of people understand that Haiti is the poorest country in the Western Hemisphere, and it's in constant need of support. But I just wanted to throw out a couple of these statistics and numbers for you. So 80% of patients don't have access to those sanitation facilities, like clean latrines or clean water. 60% of patients do not have access to basic health services, and they only exist on about $2.42 a day. 45% don't have clean drinking water, and then 42% of Haitian women give birth without a skilled birth attendant, although they have a very high birth rate for the country. So the life expectancy is only 64 years old, and there's an almost 11% higher chance of dying before the age of 5 in Haiti. So just a few of the many reasons we work in this country, other than it's an absolutely beautiful country. All right, so what's FFRC's community impact? We've performed over 1,500 surgeries since the lifespan of FFRC. Those vital health clinics that I spoke about that are 4 times a year, we'll see anywhere between 2,000 and 3,000 patients in the 10 days that clinic is operating. So we're able to see roughly 15,000 patients annually, and we employ 40 in-country staff, so we're able to give a living wage and help with the Haitian economy and employment rate. Here's a picture of our Haitian or in-country staff. These are the people that have been operating the FFRC clinic. We used to work right beside them when we got to travel to Haiti, and now they are completely self-sufficient, running the clinic and the facility all on their own. So we're just really proud of this team. Okay, here's a shameless plug. sort of. My sister, who runs the WASH program, also wrote a book about Haiti and wrote a book about FACO. It's called The House of Life, and it's actually the origins of how Dick and Barb first went to Haiti in the 70s, and then they were, almost at retirement. They were already in their late 50s, early 60s. They could have easily lived a retired life, and they decided instead to invest all of their money into starting this organization. So this book is available. If you want information, more information as well, fatco.org is the website. And I think that's the end of my presentation. Yeah, that's it.
You have questions?
Any
I have
questions?
a question. Is it 100% donor funded or
It is,
or
and we do,
grants or?
it's private. We are delving into grants, but because we're such a small organization, we have 5 people on staff. The grant writing component is always been a challenge for us. So we get primarily private funding. Yeah, by doing, our executive director wears many hats, but his primary hat is being our he's our development, he's our marcoms, he does live it, but he does a lot of our fundraising.
So it's Rotary, have you been able to connect Rotary, or did they connect Rotary with this organization, or those are separate?
No, actually, we haven't utilized Rotary as a means for support yet. Our primary support, because it's a Peoria, Illinois-based organization, is kind of always been focused in that region of the country. Our executive director is also a member of this local Rotary chapter in that area. But he's been branching out to different areas and doing traveling around. But he does a lot of fundraising and advocacy, kind of focusing on like healthcare systems and other health-focused stakeholders that may be interested in supporting a clinic like this. But Rotary would be a fantastic opportunity because Rotary is also focused on health, especially with their polio advocacy and just generally in community service. So.
I was particularly interested in the WASH part of that, because I paid attention to Rotary and WASH. I'm curious, all we read is just how poor everything is, and how awful everything is, and how logistics are terrible, on and on and on. But you seem to have broken the code as far as logistics. I mean, you're getting your supplies in there and stuff. How much more of a need is there, even in that particular area, than what you're providing?
An immense need, yeah, unfortunately, because it hasn't gotten any easier, especially with what's going on politically. We had a meeting yesterday morning where we found out that all the roads, even to the next town over 10 minutes away in Jacmel, which is the next big town over, have now been completely blocked. So, and we're typically, our country director, Andre Boye, is typically traveling to Port-au-Prince, which has many, many roadblocks, to pick up the medicines that we're ordering and shipping to the Port-au-Prince airport. So shipping costs have gotten astronomically high. We've still been able to get, so we've gotten all the medicines, we've been able to get all the supplies in, but we're paying a hefty price for it.
When you say roadblock, you're talking about gangs?
Literal
roadblock.
roadblock. Yeah, oh, yeah.
Roadblock where they're
Yes.
like,
Oh,
in order
yeah,
to
yeah.
pass,
They like,
control, right?
yeah, typically they'll do fires in the road. Sometimes it's a matter of if you know how to either get around the roadblock or if you know somebody to talk your way through it. But the issue is that even though our country director and our patient physicians are extremely well connected in the area, we're putting their safety at risk by asking them to continue trying to go through these gangs and whatnot. So, and I don't want to say we're a drop in the bucket, but because we see so many, we do see thousands of patients annually, but Haiti is a small-sized country of 9 million people. So it's really, really populated not for the amount of land mass it actually has. So, you know, if you want to go to any other health facility around, you're probably going to be paying for it. And the community just doesn't have money to pay for healthcare.
So was there a plan or is there a plan to expand?
We've always wanted to expand. The challenge has always been funding. So, and then now I would say an additional challenge would be the security issues. So 2 ways that we've always wanted to expand. One would be clinic is open every day of the week, year round, all the time. So another way we would expand is taking the clinic and making it more mobile. So you come to our facility, or we have vans that drive out into the really rural areas where people aren't able to, you know, walk for 2 or 3 days to get to our clinic. We can come to them.
Right.
Yeah, it's definitely part of our 5, 10, 20-year strategy to continue growing the organization.
Do you still have a group of volunteers that go over, or are you just letting them run it now?
We have volunteers that are so ready to go. Everybody is dying to go back, myself included, but we just can't. It's just too dangerous. So we keep saying maybe next year or maybe next year. Now that, so whether it was underreported or not, Haiti didn't report a whole lot of COVID cases, but during 2020 and 2021, the primary concern was we do not want to bring COVID into a country that potentially is, for the most part, managing their cases. Now it's much more of a security issue, and putting, you probably heard about the ministry that was kidnapped last year. So bringing Americans in to Haiti would put ourselves at risk, our staff at risk. So that's going to be a big question mark for a while, I think.
How do you, have you had any trouble in your communications with Haiti?
In terms of reaching our staff there? No, I would say one thing that we did that was worth the time and effort was investing in really good internet access at the clinic. So our country director, Andre Boye, is in pretty much constant contact with us. We can reach him very easily. Yeah, we see him, can WhatsApp with him. You know, he's a very busy person, but in terms of technology and communication, we're fortunate where we don't have that issue.
Oh, that's great.
Yeah, because their safety is the most important thing to us.
Any idea where the closest Rotary club is to that?
Into the clinic, or I'm not. Oh, I'm sorry.
That little area?
I'm not. Yeah. You mean in Haiti specifically, or? Yeah. No. There's.
Stan would know. He knows where every is.
He's been all
I
over.
know.
I can find out.
Okay, you can.
I'll probably have it on my phone. But I want to thank you for letting us know how people can have an impact around the world by doing their work right here. It's very important that we look at that. And it was interesting. I knew you'd be interesting, so I appreciate your time.
Well, thank you for having me.
No,
Yeah. I feel very passionately about this organization. I plan on working for FFRC forever.
Yeah, we understand
Thank you for
that.
your
That's why you
time.
make a good Rotarian. So we appreciate it. Thank you very much for coming.
Thank you.
50-50. Where's Lori? Where's Lori? No, these are not. Oh. All the other half is there. Good try. All right, get Erin to And the number you need to call is. Draw the first one and put it aside. And then draw 3 more.
If Lori left, we. Graduate on.
Okay. Going to read out the number of the last 3 numbers of the first ticket.
All right, last 3 numbers, 094.
Wow.
Ah,
Come on. Come on.
Here we go.
That was.
Madam
incorrect.
President?
Aaron, please draw again.
no, Joyce's don't count.
Could I request a shuffle on that deck, please?
Shuffle the deck.
No, yeah, since I didn't get the winning
this
ticket, let me go ahead and shuffle that because I know a couple people saw the card last week.
What are you gonna put the card back?
No, I'm not.
Yeah, put it back in the deck.
Ace of Spades was on the bottom. Somebody said that last week.
At this point.
What did you say it when? before they-
Because I didn't want you.
I wasn't.
But you might have won.
Might have could have.
Might have won the next. So now.
No, I wouldn't have picked the last one. See, you should have. It is fair.
You know, if you do win,
It's fair to
you
guys,
have to
but
transfer now.
chances are not good.
All right.
That's so wrong. You know, had anybody else pulled the ticket, would you have done that, jumped up? and
Wait,
done that?
that's what she wants to pass.
Of course not. No, I don't.
Oh, it was your ticket?
Yeah.
I didn't know why you were so upset.
It was such a joke.
Any card.
No, not any card. We don't want that one picked.
No, not that.
Close.
Show it to us. We gotta tear it up.
Oh, that was the
All right.
first one. I get to pick another one.
No.
I pulled one out. Where is the other one? Did you pull it out?
No, these, you mean these three?
I thought you picked another card.
No, that's that other club you belong to. That's that other club you belong to.
Okay, and then I guess Lori's got prizes for the other 3?
Oh,
There
they're-
should be an
oh,
envelope
they're
if you want to do it. I mean,
Oh, yeah, I told you you
Yeah.
should have pulled it first.
Okay,
Read
so.
that number, next number, please.
Okay, 414.
No, that's not big. See, now I'm getting.
Lord.
that's me.
Okay,
No, wait a second.
That's George.
It is George, okay.
Okay, next one.
345.
Oh, man. Way to go, Sam.
Oh, that's me.
Okay.
All right.
George, Mel, and one more.
423.
423.
No, there. It is wrong.
Four, two, three. That's done. Okay.
Okay.
So George, did I get it? Melanie.
Kearns, could you go out of this, please?
Just kind of biased for restaurants.
It's not actually.
If we can, the 4A test, the things we think
Thanks,
they
thank
do.
you.
Is
Is
it
it true?
to
Is
bear
it fair
all
all
concerns? Will it build goodwill and better friendships? Will it be
Then,
beneficial
to all concerned, will it be fun?
And our motto, service above self.
Service above self.
Y'all have a good week.
Thank you.
Thank you.
See you next week. See you next week.
Good seeing you guys.
Thanks, Aaron.
Good chance.
Thank you so
I heard you.
We're all out there, several shout outs. Yeah.
Yeah, no, you're back. I know. Did I keep rolling?
These are so good. Except
I'm looking for colors.
This is what we're doing.
What they do is.